So people understand when you do tests, have one sample, one testing, and one result. So we try to aim to do is 96 samples can be done at once. So in the population level, you can do, the more you do, the cheaper you can be, right? And become more feasible in the population screening setting.
Hi, I'm Beth Fisher, Director of Intellectual Property at WARF.
And I'm Jennifer Gottwell, Director of Licensing.
And we're here to nominate May Baker and Brian Conti for the 2022 WARF Innovation Awards.
The screening test they've developed is a kid-friendly version to detect PFH. If we detect this disease early in children, they can be treated to prevent development of heart disease later in life.
We can't wait to see how this innovation develops, and WARF will be with them every step of the way.
My name is May Baker. I am the newborn screening director at State Laboratory Hygiene. I also a professor with the Department of Pediatrics.
My name is Brian Conti. I'm a chemist and a researcher in the newborn screening program at the Wisconsin State Lab of Hygiene.
Familial hypercholesterolemia is a common cardiovascular disease affecting 1 in every 200 to 300 people. Low density lipoprotein cholesterol, we often call bad cholesterol, starts to accumulate in blood during the childhood. Eventually will deposit in the artery and cause heart attack. So we aim to develop a simple but reliable, high throughput method to identify children with these disorders early and treat them at early age. It's more precise, if I can use a term, because you use just general cholesterol can be caused by so many different causes. And we also heard good cholesterol, right? It's a high density. So if we target this specific ones, it will be better to predict the disease.
So the first step is sample collection, and this can be done at home by individuals themselves, and it really requires just a very small volume of blood. So a finger prick of blood is taken and spotted onto filter paper, and that's allowed to dry. So now this dried blood spot is then sent into a medical facility by mail. There, in the lab, a 1/8 inch punch is removed from the dried blood spot and deposited into a 96 well plate, along with other samples for high throughput processing. The lipoproteins are released into a liquid where a subsequent chemical treatment preserves only the low density lipoprotein cholesterol. Now this preserved cholesterol is then extracted into another solution that contains a known amount of standard. And then finally, using tandem mass spectrometry, we measure a specific and sensitive signal that is produced by the cholesterol in the standard. So this process is very simple, it's very reliable, and using these measurements, we can easily calculate the low-density lipoprotein cholesterol levels in the original blood sample in a very reproducible manner.
Preliminary data indicated the technology works. So our plan is to further validate this based on the clinical testing standard, so we can widely implement in the clinical testing setting.
Because we take such a small volume of blood, we really need to have a way to measure this in a sensitive manner. So using tandem mass spectrometry is really good for that. We can use about 1.5 microliters of serum from this blood, equivalent to actually perform our measurements.
It's important to mention that this method can also be used screening for adults with these disorders, and also can be used for the disease monitoring.
The big sells of this is that it requires a small volume of blood, and once you take this at home, you can send it in the mail and it's stable at room temperature, as opposed to traveling to a medical facility where you actually need to get your blood drawn by a specialist and you need to make an appointment, you would get a card at home and then do it yourself, send it in.